I got this tweet today, actually, right before we came on the air, and it was a tweet from Dr. Serena Chen, and she asked me if I can hear my biological clock ticking. And she's going to be on the show in just a minute, and she's going to tell me why I should hear it and if I'm hearing it, because all of a sudden, once I got that tweet, I'm hearing tick, tick, tick. So she's got to explain this to me. But Dr. Serena H. Chen is the director of the Division of Reproductive Medicine in the Department of Obstetrics and Gynecology at St. Barnabas Medical Center. She's board certified in obstetrics and gynecology as well as reproductive, endocrinology, and infertility. I can pronounce all those words because I watch Grey's Anatomy and I love it. She's been named the top doctor in New Jersey monthly survey every year from 2007 to 2013, and one of the best doctors in New York Magazine in 2013. I'm excited to talk to her tonight. Dr. Serena Chen, welcome to the Chelsea Krost Show. How are you?
I'm really good. How are you?
I'm doing very well. So you scared me with that tweet. We got a lot to talk about, Dr. Chen. So first and foremost, thanks so much for coming on. It's a big topic what we're going to talk about tonight, and it's something that a lot of women, are facing as they get a little bit older, and that's the topic of egg freezing. And there's nobody better to talk to you than you. So can you tell me a little bit about, the process of egg freezing and how it is an option for women?
Well, egg freezing is an IVF-based technology. So that's the whole in vitro fertilization, making babies in test tubes, which we've been able to do since 1978. But egg freezing is relatively new. Usually when we make embryos and we make babies from test tube embryos, they're from fresh eggs. We don't freeze them first. But very recently, the American Society for Reproductive Medicine has declared egg freezing for fertility preservation before cancer treatment to be non-experimental, which is a huge breakthrough because just a few years ago, if you had come to me and said, Dr. Chen, I want to freeze my eggs because I'm worried about my biological clock, I would have said, I'm not sure it's really a good thing to do because the pregnancy rates right now are really low, and just a few years ago it was less than 5%, and now at some of the best programs in the United States, we are seeing pregnancy rates that really approach fresh egg pregnancy rates, 50 to 60%, depending upon your age and your situation. So it's really now very practical to think about using egg freezing as a method for kind of stopping the biological clock or making it tick a little bit less loudly.
Wow. I mean, obviously, you need to do your research before you go ahead with the process. But, when is really the best time if you're, still, single? When is really the best time to start actually thinking about it? If kids are what you want, and it hasn't happened for you yet, when should we start that thought process? And don't tell me 25 because I'm 25.
That is an awesome question. And I get asked that question every single day, and honestly, I don't have the answer. I really think that's kind of an answer that you have to explore for yourself. From, scientific perspective, we can say, well, we start to be able to measure a decline in people's fertility and women's fertility around age 27, although it doesn't decline that quickly until you get to be maybe more around 35, and of course the decline is much more quick over 40. Everybody's a little bit different. Some people are more fertile than others, but I think the important thing is that if it's something that you're thinking about, something that's important to you, the big thing is to become informed, is not to, put your head in the sand and not to run around like a chicken with your head cut off thinking the sky is falling, but go out there and do some reading and talk to your doctor and get some information and figure out, what are the pros and the cons? What are the things that are going to be right for you? It's certainly not for everybody, and I think people get caught up in this whole technology thing and don't realize there's all kinds of other things they could do, like being a normal weight. That's one of the biggest issues I deal with when I'm trying to help people get pregnant. The recent article in Atlantic Monthly that said, oh, women shouldn't panic about getting older. It's really nothing to worry about. The caveat there was they were saying age-related infertility is not that bad in women who are completely normal weight with no medical problems at all. And obviously, a lot of women may have some risk factors. Maybe you are overweight. Maybe you have a family history of infertility or endometriosis, or maybe you had surgery in your pelvis before. Maybe you have a history of cancer, or maybe you're just concerned. And I think anybody who's concerned deserves a conversation with an expert. It doesn't mean we're panicking, right? It just, we're being proactive.
Yeah, I mean, and, it's funny, you rattled off a couple of risk factors, and, I'm sure that there's a much longer list, but I actually fall into some of those risk factors. So, it's definitely something that I have to keep on my mind as I age, so to speak. I actually like being 25, so I got to stop harping on it. But
you're young. You're doing okay so far.
I'm trying, I promise. So is this, if somebody goes along with egg freezing and makes a decision, is there a guarantee of pregnancy, or is that just a rumor?
That's a great question. And, right now, egg freezing is there's still not many centers that actually have pregnancy statistics where they freeze the eggs, thaw the eggs, and make babies and actually can give you real numbers. But that's changing rapidly. I think the technology is going to spread, and it's going to be more and more commonplace, and people are going to get better and better. But you do have to know what the statistics are in your particular situation, and that's going to depend on the program that you're at, the laboratory that you're at, what is their experience, as well as your own particular characteristics. Like some people have more fertile ovaries than others, even if they're at the same age, and different risk factors, different health profiles. And so that's why it's important to have a conversation. It's great to listen to this show and become somewhat informed, but I think if it's something that somebody's concerned about, they deserve to talk to an expert. And that's what's upsetting about some of these articles that say, we shouldn't be talking about the biological clock. Women shouldn't be panicking. And, I really feel like that's a decision that should be left up to the individual woman. I mean, we're big girls. We can think about these things and figure them out for ourselves. These are our bodies. We should be making those decisions.
Yeah, absolutely. And it's great that you brought that up, because I am seeing this kind of, a trend of obviously we're in a big different world where science has come so far that women are able to get pregnant later in life without using certain, IVF treatments or egg freezing. But that's not every woman, and I think that's a great point that you bring up, is that, everybody's different. And if you are, feeling like you are getting a little bit older, it's something to definitely research. I mean, we've come so far. But take me through a little bit of the process. Are there a lot of costs involved, or is there storage costs?
That is one.
I guess you call it storage costs.
That's a very good point. It is, right now it is definitely not covered by most insurances. I see a lot of different patients with a lot of different insurances, and egg freezing, even for cancer patients, where there's a very strong indication to freeze your eggs, because we know cancer therapy really can destroy eggs. The insurance companies are really not covering this. They're still considering it very, very new. They're considering it elective. So that's definitely a big part of the decision making for a lot of the patients I see. A lot of people come in with many different things that they're concerned about. So I see women who do have a partner, actually, but are not sure necessarily that this partner is the one they're going to have a family with, and people have to wrestle with the financial concerns. It can be a very expensive process, thousands of dollars to freeze one batch of eggs. And in our lab, which we feel has great pregnancy rates, we're getting maybe from one batch of eggs for a woman under 35, maybe a 50 to 60% pregnancy rate, so that honestly a lot of women would prefer to freeze maybe 2 or 3 batches of eggs. Those questions are all things that women have to wrestle with. Some women are older and they're thinking, maybe I shouldn't freeze my eggs. Maybe I should get pregnant now. Like maybe I shouldn't wait for the partner. Should I go out and go to the sperm bank and buy some sperm and think about single parenthood? So a lot of my patients are not just thinking about egg freezing. They're thinking about, kind of life itself and where are they going and what are they going to do about it. And, in some ways it's very empowering to have all these technologies available because there are so many choices, but sometimes it can get a little overwhelming too because there are so many choices.
Of course. I mean, and that's also becoming a much bigger reality is people, having such a desire to have a child, maybe not have the partner, but want a child. And, with sperm banks and everything, it's definitely becoming a reality that a lot of women are thinking about. So it's something we got to, us women, men have it a lot easier than us. We got a lot to think about when it comes to, our biological clocks and our bodies. But what would be, maybe just a couple pointers of advice for a woman before, to go through? What's your biggest point of advice for a woman going through this?
Well, I think something that's accessible to all women. I mean, egg freezing, I think it's amazing how advanced the technology is, and it's wonderful that this technology is now available. And I do think that things are changing every day, so I don't think people should just automatically assume it's not for them. If they're wondering about these issues, if they're wondering about the biological clock, they should definitely talk with somebody and get, real advice for their particular situation. The other thing I think we all forget is that there are things that everybody can do every day to help preserve their fertility. Smoking, you're killing eggs every single day when you smoke. Even secondhand smoke kills your eggs. Women exposed on a regular basis to secondhand smoke will have higher rates of infertility, miscarriages, birth defects. It's a really powerful toxin, and that's something that everybody can do. And, quitting smoking saves you money. The other thing is just being healthy. Get 7 hours of sleep at night. Try to eat healthy. Try to get to a healthy weight. Over 50% of us in the United States have a weight problem, and that's something that does have a direct impact upon your fertility, and obviously the rest of your body. It affects everything, and fat it's not just the weight; it's actually an active endocrine organ that we think a lot of the damage now is coming from inflammatory molecules, that you're actually damaging your body with inflammatory molecules that comes from the fat, because it's an active organ. It's not just tissue sitting there. And that's something, that's, I think, accessible to everybody, even though egg freezing may not necessarily be accessible to everybody. The other thing is, I think you touched on this earlier, is that there are so many technologies, and we see in the news every day all these miracle babies being born to women, a lot of the stars over 40, really advanced ages, and people are thinking, I don't really have to think about it. I don't have to think about it. I don't have to worry about it. When the time comes, I'll just go and I'll have one of those treatments, and they'll make a baby for me. And I kind of can make a baby for anybody, but it can be expensive. It can be expensive, and it's not necessarily going to use your own eggs. That's the issue as you get older, is a lot of older women that are having babies with IVF, we're having to use somebody else's eggs. We're having to use a younger donor egg, and that's a tough thing to go through. It's tough. It's expensive. It's emotionally difficult. So, yeah, we can make a baby for anybody, but it's a little more complicated than that. So I think the big thing is, don't just assume that it's just going to happen when you want it to happen. Take control of your life. Be proactive. Become informed. See your doctor. Try to be healthy. If ultimately you decide that none of these things are for you, at least you made that decision instead of, the decision being made for you.
Yeah, no, I definitely could not agree with you more on that, and I think that's really important for, for women to take total ownership of their body. And as a young woman, I kind of, I strayed away from that a little bit sometimes. I was a smoker. I'm just recently starting to quit. And
good for
hard
you.
Money, but I'm trying. I'm doing so good.
Good for you.
But
throw those things away. They're killing you.
I know. I live in New York, so now I'm totally rich because I quit smoking. I have an extra, $100 a week, which feels
there.
New York,
buy
it
yourself
like
something nice. Yes, totally.
I definitely will. But yeah, I mean, I think when we're young, we kind of have this almost wrong image of whatever we do now won't affect us. And in the long run, it won't affect me when I quit smoking or when I lose the weight or when I'm a little bit healthier and I actually sleep at night. But, it's really refreshing to talk to a medical professional who just, basically he just told me to stop doing all the things that I shouldn't be doing. And I'm going to listen to you because you have a lot of experience.
I want you to message me when you quit because I'm going to be very, very happy for you. That's
I definitely will. I will definitely for you, and I just totally let that out on air, but whatever.
Now that you've said it on air, now you're committed. You're committed.
I know, and I have friends listening right now, and they're going to hold me to it. I promise.
Okay, then I'm going to squeeze another promise out of you because this I think is a huge factor in quitting smoking. Is tomorrow you need to tweet your quit date. You need to think about it. Think about it overnight and tweet us your quit date.
I definitely will. I have that, so I will tweet that out. I'll put myself out there, and all the Twitterverse can hold me to my promise.
Okay.
Back to the eggs real quick. If you say you do want to go ahead with the process, if you freeze one batch of eggs, is that enough, or should you do the process?
That's a very good question, and I think that what we're talking about is getting to being proactive about getting to a place of no regrets. And there was that big article in the Wall Street Journal about the woman who had frozen 70 eggs. And she had the means and the ability and the endurance and the will to do that, and that's what made her comfortable. Most of my patients are freezing just one batch of eggs. I have patients all in between one batch of eggs and 10 batches of eggs. And I think that's a very individual question. It depends upon your age. It depends on your financial means. And it depends a lot on where you are psychologically and emotionally. There are no guarantees. There's no crystal ball. You may freeze these eggs. You may never use the eggs. You may freeze eggs and then meet Mr. Right and fall in love and go off into the distance and have babies on your own. So it's about, trying to change your numbers, change your probabilities, and make yourself get to a more comfortable place where you feel like you did the right things for yourself and for your health and for your future. And for some people, that's one batch of eggs, and for some people, that's more. Does that make sense?
Absolutely. I mean, no, of course, it's definitely a process that if you're going to go through it, you got to definitely do your research. It's not something you can jump into. And I think another important factor would be to find, a doctor that you're comfortable with.
And we actually make a lot. I mean, we actually have a full-time reproductive psychologist here who deals with a lot of these issues from the whole spectrum of thinking about freezing your eggs all the way to people who are making decisions about giving up on fertility therapy or thinking about adoption or stopping. And I do think that that's something that the American Society for Reproductive Medicine, ASRM, recommends as well. And a lot of people look at me funny, like, why do you want me to see the psychologist? But after our conversation, you can kind of see that having somebody to help you sort out, because it's not just about egg freezing. It's a lot of these questions are about your life. Egg freezing is what brings you into the office, but it brings up all these other questions. And I think a lot of my patients have found, talking with a therapist to help them just sort out their thoughts and their feelings helps them get to a place where they can decide, okay, one batch is right for me, or two batches, or no batches. It's just not right for me.
Absolutely. You have been so informational for me tonight. I have thoroughly enjoyed speaking with you. Where, if I want to find more information, what's the best website for me to go to maybe get a kickstart of my research process?
Well, we'd love for you to visit our website at sbivf.com, and there's tons of links there to places like asrm.org, and both of those sites have a lot of information and blogs and posts and articles about IVF and reproductive technology and fertility and infertility and, of course, egg freezing. And we do have actually we actually have a message board that's manned 24/7 that you can go to at sbivf.com. And it's, I have 5 partners, the 6 of us, all board-certified reproductive endocrinologists. That's part of what we do is we answer the questions on the message board just to give people more information and advice.
Great. Awesome. Thank you so much, Dr. Chen. I really appreciate you coming on tonight to the Chelsea Krost Show, and I promise you I will tweet that tomorrow.
Okay. I'm going to be looking for it.
I promise. I gotta take a night to think about it, but then I'll tweet it out tomorrow.
Okay.
I really hope my mother's not listening tonight. But anyways, thanks so much. I look forward to speaking with you in the near future. You have a good night, Dr. Chen.
Okay, you too. Take care. Bye.
All right.